Hi, welcome once again to Moorgate Andrology. You know, if you're doing your research into penis enlargement surgery, then one of the questions you're going to want to ask yourself is, how safe is penile enlargement surgery? How safe is penile enlargement surgery? Well, safety is at the forefront of everything we do at Moorgate Andrology, and that's really where everything starts. Remember, a penis enlargement to increase your length and to increase your girth is a surgical procedure. And therefore, we have to consider your safety first. So one of the things that will happen when you have your consultation is that your medical history will be checked. So this will be a run through of your past medical history, your current medical history, any medication you're taking, any health conditions that you may have at the moment. So all these investigations take place as part of the consultation process. Now, in some cases, we may need more information from either your doctor or your specialist if you're receiving specialist treatment for another health condition. And it might be that the urologist or in fact the anaesthetist may need more information before a decision can be taken about your surgery. So these things are very important. Penile enlargement surgery is nearly always undertaken under general anaesthetic. So a general anaesthetic means that you are asleep for the procedure, which typically takes about 1 hour. It's a short general anaesthetic, it's not a particularly long operation, and therefore you're able to go home on the same day, but nonetheless it is a general anaesthetic. And there may be certain tests to have as part of that pre-operative screening to make sure you're fit and well for the surgery. These may include some blood tests and MRSA screening, which is a swab test of the mouth usually. And if you have other health conditions, it might be that you need other preoperative tests such as ECG or chest x-ray. Most of the time not, but if you have any chest complaints or any other respiratory problems, then these are usually tests that are done as part of the assessment process. So before you have the operation at all, there's a process which has to be done, an evaluation of your overall general health. Now, one other aspect we should consider when we think about how safe is penis enlargement surgery is the aftercare. So when the surgery is done, there is a recuperation period, a period of time, usually a matter of a few weeks, where you will need to recover and follow very carefully some post-operative advice. If you've had lengthening surgery, then you will have a little cut at the base of the pubic area, and there'll be specific advice on how to keep this area clean so as to avoid any infection. Infection rates are extremely low in penile enlargement surgery, typically about 1 to 2%, and obviously we want to do everything we can to prevent an infection. And that's the same after any type of surgery. You'll be on a course of antibiotics, for example, and it's very important that you take your full course of antibiotics, even if you feel well. It's very, very important to finish your course of antibiotics so we can minimize any risks of infection. In terms of the fat transfer aspect to increase your penile girth, this is a relatively small fat transfer because we don't need to aspirate too much fat. This is not like a big liposuction procedure which carries additional risks. It's not like that. But nonetheless, you'll need to follow the correct advice in terms of massage of the penis to prevent post-operative complications such as nodule formation and also tightening of the foreskin if you have foreskin. So, penile enlargement surgery can be an extremely safe procedure, and indeed is. But the key is that you need to go through a process of assessment and consultation to make sure that you are fitted well enough for the surgery, and also after the surgery you need to follow the correct post-operative advice. Well, that's all from me today. I hope that's given you some insight into how safe is penile enlargement surgery. Until then, I'll see you back here next time at Moorgate Andrology. Bye for now.